Welcome, everyone. Thanks for joining. We'll get started very soon. I'd like to be respectful of time, so we'll just give it a couple minutes. Hello, and thank you for being here today. My name is Trish Violante, and I am joined by Phil Sullivan and Stacy Cosgrove. We are with DB Tech, and we'd like to introduce you to our downtime solution. Our software helps hospitals during both scheduled and unscheduled downtime events. So when your network or your EHR is down, we give you the ability to register patients, print patient wristbands, and most importantly, access to critical patient information. At this time, I'd like to introduce Phil Sullivan.
Thank you, Trish. We want to just talk real briefly about DB Tech. We are proud to announce that we're celebrating 40 years, our 40-year anniversary this year. Document management is what we do. Capturing data, securing healthcare data has been what we've done for a long time. We have over 150 satisfied healthcare customers. Another thing we're really proud of is we seamlessly integrate with all EHRs. Whether you're Epic, Meditech, Cerner, doesn't matter to us. We use industry standards like HL7, and reading and writing data is our strong point. So we could capture from any system, we could export to any system. So we're going to kind of make your life real easy along the way. Our journey at DB Tech has taken us towards downtime solutions and protecting data, and we are experts in downtime. Our core product has always been RAS. Many of you are familiar with RAS capturing data. And in our second product, eForms, been in use for many, many years. That's kind of built up to a culmination of downtime, the electronic capture, the patient registration, the electronic forms, and downtime solutions is what we're here to talk about today. And that's what Stacy will demo for you shortly. On the webinar today, just a few things we want to cover. How to plan for unplanned downtime. Planned downtime, everyone, probably has a plan in place monthly. Here's what we're doing. Here's the time. But the real challenge comes for unplanned downtime because you don't know when it's going to strike. So we'll talk about how the DB Tech downtime solution could help you kind of make that seamless and take the pain out of it. Why electronic solutions are superior to paper-based. We hear often that we have a downtime solution in place and it's paper-based. One of the things we see all the time is a lot of that paper doesn't make it back to the EHR. So that's why we stress electronic solutions being important. We'll also cover how this solution improves patient care while saving your hospital money, and the ROI is significant. EHR versus network downtime. They impact you and your staff in different ways. We'll cover what the different options are and, more importantly, how we protect you during both events. And the best part is recovery after a downtime event. No keying. We're going to do an export. We're going to get you live after the event real quick with rapid recovery. So we'll get you over to Stacy in a moment here. She's going to show you a quick downtime demo. Just a few housekeeping notes. There is a chat option in WebEx if you have any comments or anything along the way. We do ask you to ask any questions. Please enter them in the Q&A section, and we'd be happy to answer them. So without further ado, thank you, Stacy.
Thanks, Phil. Thanks, Trish. Hello, everyone. I'm Stacy Cosgrove. I do implementation support here at DB Tech, and I've had the pleasure of working with many of our 150 plus satisfied healthcare customers. As Phil mentioned, our downtime solution came about as a result of very strong, proven solutions. So it was almost a no-brainer for us to come up with the downtime solution, and it's been very easy for us to implement because we've done that so successfully for many years. So that said, let me go ahead and start sharing with you my demo system. And we'll talk about the points that Phil made and how you can have a return on investment pretty quickly. So let me share with you RAS-I downtime mode. So what you're seeing here is the downtime or RAS downtime viewer. What you'll see from the first glance is this viewer is almost broken down into two sections, the top section, the bottom section. We have patient folders. Those are electronic folders that are created in real time during uptime. So while you are registering your patients, while your reports are running and winding up where they need to be, we're gathering that data. We're collecting that data mostly via HL7. So we don't even ask you to create new interfaces from scratch. We'll take copies of what you have, maybe from your registration system to any other downstream system. So we're creating your database in real time so that when downtime occurs, you're ready. And this is really how you prepare for the unplanned downtime. Planned downtime, I won't even say it's great, but the only great thing about planned downtime is you get to go and distribute paper in advance, right? Well, with using our downtime solution, you don't have to prepare in that sense, nor can you prepare for an unplanned, unscheduled downtime. The information's here. You have patient folders that are created per encounter. So you will always have access to the most recent encounter, or if your network is up, you will even have more than that. You'll also have access to documents. Now, in the case of preparing for a downtime, what you'll probably find most is these critical reports that you might need in your downtime system that we can add to the patient folders. As you see me scroll folder to folder, you're seeing different documents. That's because the documents that you see in the section at the bottom, those are for the patient that's highlighted at the top. But what we also do is we create a folder into which larger reports are saved. So maybe on an hourly basis, you send an updated census report. Maybe you have an ED tracking report that you'd like to have, historical lab results, radiology form. And what I don't have here is actually something that 100% of our customers are sending us is a MAR, the medication administration report. We're collecting these reports in real time and we're updating them in real time so that when the system downtime occurs or the network downtime occurs, you will be able to go into our solution, find the most recent information, either your report or your patient encounter, and you'll be able to pick up where you left off. Okay, so preparing for unplanned downtime, we do that during uptime. We're getting your HL7, we're building these patient folders in real time, and you can store as much information about a patient as you want or as little, enough so that when you have no other way to get their information, you'll have it here in our solution. So these documents can be added during downtime. If downtime hits and you've got patients coming into the emergency department, you can register them, so to speak. You can create new encounters in the downtime solution. And so to do that, we even customize these screens. These are very customizable. You could do a quick reg in the ED, which allows you to complete just a few fields. We even have a way for you to look up historical information so that you're not creating duplicate. You don't have the issue of duplicate medical records. In other scenarios where you don't have this information electronically, you're going to wind up with duplicates. Instead, we'll allow you to look up a patient's history. We'll pull forward more recent information for that patient, and then you can select the information that you want to use, and it will pull forward certain information. Obviously not things like visit related information, but maybe more like the demographic information, insurance information. And so you can get your information into RAS-I more quickly, get that quick reg done, get that patient banded. How are you getting your patient banded without writing it out? Easy. Let's go ahead and just do a quick reg for Mr. Anderson. By the way, you can also have a bank of downtime numbers. I happen to not be using that feature, but you can have a bank of downtime numbers and assign them to specific workstations so that there's no contention with choosing downtime numbers, but you can actually have our solution automatically assign the next available patient number, medical record number, master patient index, etc. I just so happen to not be using it, so I can personally type in the number. There is that available as well. So we'll go ahead and quick reg that patient. That folder shows up immediately. I now have a new electronic folder for John Anderson. Now, we know in the ED, the next step is get that patient into triage. You want to get that patient banded. So you can use our eForm solution that is built into the downtime solution, and you can do your printed forms from here. Adult bands, peds bands, any template that there is, I probably have. So we can help you build your forms, but you would, in essence, be able to print armbands, print labels, and get that patient on to, oh, I didn't check the box, get that patient on to where they need to be. So you can print locally, but you can even, if you see this button here, send to queue, you can even print remotely. So if their network is up and you have installed different network printers, I could print this to a unit across the hall. I could print this to a unit on another floor. And this way you're remotely printing as well. It's not just local printing. Now, during a network downtime, that's a little different. We'll talk about that. But I can send these armbands, labels to the printer and get my patient on to where they need to be. The other types of forms, once that patient's been triaged, they're put in a room, you need consent to treat at a minimum. You can also get those forms done right here in the downtime solution. Our interactive forms, they're built using Adobe, a very well-known product. We can help you so that it pulls information from the patient record that you've just created here, or if the patient record already exists, it'll pull the information from the record here in the downtime solution. I can choose a consent form. So let's go ahead and run a general consent form. It will open in Adobe. Get that over here for you to see. And you would be able to see the form running with patient information on it. You can capture signatures electronically. You can save it into the downtime system, and it will be available immediately. It tells you that form was captured. And here it is right immediately in the patient folder. Now, the other nice thing about this that speaks to more efficient patient care, safer patient care, is when your network is up, this information is available on any PC that can access this application. So if I'm in the ED and the patient then gets admitted, I can tell the nurse on the unit or the unit representative, the treatment consent is in the patient folder, and that unit could access this information. So when the network is up, this information is available throughout the organization. The other nice thing about having these forms is you don't have to maintain a paper stack. You don't have to maintain the paper inventory. You can make sure that you have version control in place so that not everyone has to worry about, do I have an updated version or how many versions of the consent form are old? We store all those forms right here in the system for you, and they get updated accordingly. So you have version control. You have the ability to not have to worry about paper getting misplaced. You don't have to worry about, sometimes we know not everyone has handwriting that's easily readable. And so you've got things that are online in a form, accessible to everyone. There's no question. There's no worrying about, you can even scan the ID card, scan the insurance card. And so you can add documents during the downtime event. Now, I want to take for a second the conversation towards network downtime. I'm talking about a lot of things that you can do right now in-house, across your organization, throughout the network. But what happens when there's a more catastrophic event like a network outage? There's a natural disaster. Well, what we do is we work with you to pre-define workstations on which our solution is installed locally. And then every, let's say, hour, and you can change that interval, but we'll talk on the hour. Every hour, our solution pushes updates out to those local workstations so that it might not be a full solution, but you will have access running this application locally on a workstation that you wouldn't otherwise have. And so what are the kinds of things that we push out to that workstation? We push out your documents like your MAR, your census report, any vital patient information that you would want to have access to if you couldn't access it anywhere else or any other way. We put that out there on workstations that you would be able to use during a downtime event, and they get updated on a regular interval. The other difference is we might not send every encounter, but for every patient in your database, you will have the most recent encounter so that if John Anderson comes back again, you'll at least have that demographic information that I displayed earlier. You'll have that, and you won't again have to worry about duplicate medical record numbers. You can at least find certain information, including his medical record number, so that you're not duplicating his information. Okay. What do we do with this information? Downtime ends. Under other circumstances, without an electronic solution, you're collecting paper. You're now having to scan copies of things that you've taken, like insurance cards, identification. Now you have to go scan that paper into the chart. You have to rekey all the information that you might have just written on paper, registration information, clinical treatment information. You've got to key that back into a system and get that fed through your interface engine to all your downstream systems. They say for every hour of downtime, it takes up to a day to recover. And I personally have worked with customers implementing this downtime solution that shared stories like they were down for days and they had staff that had to go out to patients' homes to collect information that they didn't get, they couldn't find after the downtime was over. You're paying people overtime. You're losing documents. Well, with an electronic solution such as ours, you're mitigating those circumstances. You're cutting out the amount of time it takes to recover. How? Well, not only do we receive information via HL7, but we can send you the information back out of our application in a standard format such as HL7. So when the downtime event is over, if it was I say just lightly, if it was not a network downtime, we take the information as it was entered into our server, into our application, and we process it through an HL7 interface back out to your interface engine, and it is collected then into your host system, your registration system, your EHR. Your patients are then in some way, at least those encounters are created electronically. Of course, you have to verify all the information and you have to complete the registration, but that initial impact is lessened, it's mitigated because we're sending you the information electronically. You're not paying people to rekey it. We also export your documents. So any scanned image like ID, insurance card, any consent form, any other interactive form, any documents that may have been added by clinical staff, that also gets exported out of our solution and in PDF format, JPEG format, whatever you like. We can export those documents out to a network location where your other systems can pick those documents up and bring them in and index them accordingly. So you're not taking photocopies, you're not scanning and scanning. These documents can be routed electronically out of our system. The recovery efforts, again, it's the fact that these documents and the patient information is electronic mitigates the recovery. You have the ability to create any form you want. There is no limit to the amount of patient information that you can have in your database. And there's also no limit to the number of documents you can have. We have some customers that have upwards of 50, 70 different forms. Any kind of a form that you would want available to registration staff, to clinical staff. You can have nurses putting treatment notes into our application so that after the downtime event, whether you take it out via a document or if it goes into an HL7 format, you're getting that information out electronically. The other thing that you can also do, we not only did you see the quick reg, but you can then go in and edit information. And so if I were going to update John Anderson's information, I can do that. I can also do things like discharges. And so it helps with the outbound HL7, that event after the downtime. So we would then send, based on triggers and criteria, you could get an AO4, you can get an AO8, you can get an AO3. And so it meets the requirements of your host, your EHR, your registration system in terms of that transactional workflow in chronologic order. So we do that. And then in specific regard to how we do that with the downtime workstations, if you are using the downtime workstations during a network outage, when the system comes back up, when your downtime event is over, you take RAS out of downtime mode essentially, and the server goes out to each one of those workstations individually, collects all the information, processes it, and then sends it out via HL7. So even then, you're getting the information transactionally in chronologic order. So you're following that patient's treatment, if you will, in terms of being able to see that they were quick regged, being able to see that they were then full regged, doing discharges. We can also set up triggers so that you can see your transfers. We have different triggers that we set up rules that will tell RAS what type of an HL7 event to send out. And then lastly, we will continue then once the downtime is over, we go back to receiving information from your electronic health record, from your registration system. So we continue to then build those patient folders electronically, and then we can take those documents if you need them there, but we update the clinical information, such as what you see here in the downtime reports folder. We would then update that. We would go back to the uptime updates and keep the most recent information so that whether it's planned or unplanned, you would have the most up-to-date information. Hopefully I've touched on all the topics. We've talked about recovery after a downtime event, network versus EHR downtime. How this improves patient care is you're not losing paper, you're not misplacing paper, you're not making mistakes charting for one patient on another patient's piece of paper. And it saves money by mitigating the recovery efforts. You really have patient safety issues that this also mitigates. So hopefully you'll be very quickly seeing how this can help your organization. And I will then kick it back over to Phil or Trish for any questions that anyone might have.
Thank you, Stacy. I wanted to mention at this time something new that we're offering in 2023, and that's a complimentary downtime preparedness audit. So this is where we ask you a series of questions to help you determine if your organization is prepared for a downtime event. So please leave your email address in the chat and we will be in touch with you. I do see that, Phil, okay, if we just jump to questions, I do see we have a couple of questions. I'm going to be mindful of the time. You mentioned outbound HL7. How does that work when the downtime is over? How long for the information to be exported?
It's really a good question. As I mentioned, our service runs and goes out to each one of those downtime workstations. So really the amount of time it takes for that part of recovery is dependent upon two things. how many workstations you have. We have an organization that only has a handful because they use it primarily in the ED. But we also have another organization that has a few dozen workstations. The other factor is the amount, or I should say the length of downtime. If you're down for an hour, we've only got an hour's worth of data to collect. If you're down longer, we've got that much more data to collect. We process the information, and then again, once we're ready to send it out to your interface engine, it is processed and sent to your interface engine in chronologic order, not necessarily just by workstation.
Excellent. Thank you, Stacy.
Mhm.
Time for a couple more. What information can be viewed during downtime events? Are we limited to a certain number of reports?
No, you're really not actually. You can give us any report you want. Whether it's a report that is a larger report and we file it into what I showed as what I called the downtime reports folder, you could find your report in full there. You can store as many reports as you want. The other way to do it is you could then have us link reports if your report is patient-centric. Perhaps a medication report is a good example. If you've got 100 patients in your medication report, you don't want to have to go through the whole report and find Stacy Cosgrove. We can link those reports directly to the patient folder as well, so that when you go to Stacy Cosgrove's folder, you would see that particular piece of the report right in that patient's folder. So there are a couple of ways to look it up. One way would be if you wanted to print out the whole report for the unit, but if you were just looking for your patient, you could find it that way as well.
Thank you.
Mhm.
I think we have one more. Can I put electronic nursing notes in your downtime system?
You can. You can. We can have any form such as the consent form. We can have any form that is fillable. By fillable, I mean we use that Adobe product to make a form interactive, and it could be a template type of a form where you have very specific information that your team members have to fill out. You could even have something that's free text, so that if you're typing treatment notes, it can be interactive in that sense as well.
Great. Okay. Thank you, Stacy.
Mhm.
Well, I think I just want to thank everyone for your time, and hope everyone has a great rest of your day.
Thanks, everyone.